Start. Hello, my name is Jared, and this is Josiah Daniels. We're going to do a head-to-toe assessment. I'm going to start with a general survey of the patient, and the first thing we'll ask is his age.
31.
We're looking at his alertness, his nutrition status, his development, his mobility, his affect, his speech, his hygiene as he comes in. He was able to walk here, so you know that he is mobile, and he was answered his name, so we've got his speech as well. And his hygiene appears well kept, and no issues there. We'll move on to a skin assessment. The first thing we're gonna feel is his temperature. His arms are warm and dry. We're checking color and pigmentation, making sure it's normal. Texture, and it feels good. We're gonna check the turgor, making sure he's well hydrated. Hair distribution is evenly distributed. We'll notice other parts of his body while we're doing the rest of the assessment, but we're just checking the arms right now. Checking his hands and nails, making sure there's no clubbing. Everything looks good, no lesions, a couple of scars maybe. Gonna look at his head and his face. We're looking at the scalp and cranium first. There are no lesions. We're gonna have him squint and bare his teeth. This is his cranial nerve 7, and there's no abnormality. I'm gonna palpate the temporal arteries. They're smooth, and they're bilateral smooth. Down to the temporal mandibular joint, he's going to open and close his mouth. There is no cracking or clicking or crepitus. Moving to his maxillary and frontal sinuses. Any pain, and then his temporal. That looks good. Any pain there? All right, now we're going to check his eyes. We're going to check cranial nerve number 2. And I guess we'll look for and there.
All right.
2 fingers here. Oh, actually, no, we're going. As you're looking here.
2.
How many fingers am I holding? And
2.
2. And I guess. And then we'll over here.
2. All right, there you go.
Looking at his lids and conjunctiva, and his sclera is clear and pink. It looks good. Extraocular muscles, so cranial nerves 3 and 4 are going to tell us if they're working with all the movements of his eyes, if he can follow my finger around, as well as cranial nerve number 6. Everything looks great. Oh, we already checked his pupils with a pin light, so we're going to move on to the red reflex with the ophthalmoscope. Okay. We're going to be looking at the vessels in his eyes as well while we're doing this. There are no abnormalities there, no flares or bleeds from diabetes. Everything looks good now. We're going to move on to his ears. And this is going to be looking at his external ear, They're symmetrical. There's nothing. There's no injury or pain or drainage. Any pain when I was feeling your ears?
No.
Okay. Oh. We're gonna use the otoscope to look and make sure there's no drainage, bubbles, or fluid, or bulging or redness. Okay, and looks clear. Everything looks good in that ear as well. Now we got tuning fork right here. We're going to test cranial nerve number 8. I'm going to activate. Let me know. You can hear it in both ears.
Yep, seems equal on both sides.
Okay. And now we're going to do the Rhine, the Rhine test. Oop. Which let me know when you can't hear it.
Okay. Alright.
Alright. And the same for the other side.
Alright.
And bone conduction should be about half as long as air conduction. Now we're going to be looking at his nose. We're going to use the we're going to check the nasal patency on each side. Flow for me. And patency appears to be good. So now we're going to look at with our speculum at the mucosa and the turbinates and septum, and everything looks good there. Whoops, sorry. Alright. Now we're going to the mouth and throat. The lips and buccal mucosa appear to be intact, and if you the teeth and tongues, good dentition, no visible caries. Can you move your tongue around, in and out, side to side, up and down? And that's cranial nerve number 12. And if you can say ah, I appreciate that. That's his uvula and cranial nerve 9 and 10. And the soft and hard palates appear to be intact and move. All right. Now we're going to move on down to the neck. This is we're gonna see if there's any abnormalities with symmetry, has lymph nodes, looking for any pulsations. All right, now we're gonna check his carotid arteries. After I've checked them, I'm going to listen to them for any bruits. Good there. I'm also checking the trachea, making sure that it's midline. Also going to check the range of motion of the neck muscles, so if you'll move your head forward and backwards and side to side, and try to touch head to shoulder and ear. There you go. Now I'm going to check the thyroid, and that's best done if you come from the back, and most of the time it's not palpable. And if you can swallow just for me. Alright, there's no, we're also going to check for JVD, or his jugular vein distension. This can let us know if there's any heart fluid overload. I don't see any any abnormalities here. Looks good. Now we're gonna look at his back right now. Posterior chest. We're gonna look at overall we're gonna look at overall symmetry of his thoracic cage for any lesions or any abnormalities. Everything looks good. His skin looks good. We're also gonna do tactile phragmitis. If you'll say 99.
99. 99. 99.
And
99.
all right. We're also going to check for the spinous processes, make sure they're in line. Note if there's a deviation, which can show from scoliosis. Also going to do percussion over the lung field. So. Everything sounds good there. Now we're going to listen to the lung fields as well. Nice deep breath. 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 And again. Thank you. And no adventitious breath sounds noted. And now we're going to do basically the same thing on the front side. We'll start with respirations and skin characteristics, even distribution of hair. We're going to check for tactile phragmitis, so if you'll say 99.
99. 99. 99.
One more time.
99.
Alright. Now we're going to percuss. Alright, and now I'm going to listen to his lungs. Nice deep breath. Now we're going to assess the upper extremity strength. By doing that, we're going to ask him to spread his arms against resistance and push in against resistance, pull up against resistance, push down against resistance, and all our fives, that being optimal strength. And he's also going to demonstrate his flexibility in his wrists and fingers, and those all appear to be within normal limits as well. Now I'm going to check our epitrochlear nodes. No swelling noted. I'm going to check the pulses, and also going to have you make a fist and release. And that was on Allen's test. And one more. And we'll check the other side as well. Now release. And one more time. And release. Alright. That is just showing the perfusion of the veins perfusion. Alright, now we're going to move on to a breast assessment. This is going to show we're looking for symmetry, dimpling, mobility. Also looking at the supraclavicular and infraclavicular, and there areas, and no abnormalities, as well as the nuptial as well as the nipples and the axillary areas and regional nodes. And no in pain?
No.
Alright. This is also a great time to perform some breast exam teaching as well. Now we're going to move on to the heart. Please move your. We're looking at the precordium for any pulsations, heaves, checking apical impulse right here. Check the rate and rhythm, and we're going to be listening. Everything sounds good. Now we're going to move on to the abdomen. And we'll listen. If you'll lay down for me, please. Thank you. We're checking for contour, symmetry, any pulsation. We're going to look, listen, and then palpate. So looking, there's no asymmetry, no distension. Everything looks good. Skin looks good, warm and dry. No pulsations that we can see. Now I'm going to take a listen. Bowel sounds are normal in all four quadrants. There's also no vascular sounds, so that's good, a good sign. So now we're going to do some light percussion. And we're going to check over for the liver, over the right mid-clavicular line. And now we're going to check for the spleen on the left mid-axillary line. And we're going to palpate for the kidneys, as well as percuss. And we're going to do some deep palpation. Alright, we'll take on to your other side. And now we're going to take a look at the lower extremities. You can cover your chest. And while he's doing that, we're going to be looking at his lower extremities. We're looking at the skin. We're looking at the hair distribution. We're going to look for symmetry, and there's no visual abnormalities or issues. So we're going to check his pulses. We're going to try the popliteal, if we can feel it. We're going to try. Alright, now we're going to check the posttibial. Equal in rhythm and rate. Now we're going to check the dorsal pedis. As well, we're checking for temperature, and it feels equally bilaterally. We're also going to check turgor, and there's no edema noted. Also capillary refill. In toes and toenails look normal. Good range of motion. Move your ankles up and down, gas pedal, and pull against. We're checking the knees to make sure there's no pain, any pain, clicking or popping. Okay. Everything looks good there. Now, if you'll stand up for me, and you're gonna walk while we just keep an eye on you, and then as you come back, I'm gonna have you walk on your tiptoes. All right, and then back, you're gonna walk on your heels. And now you're gonna do toe to heel on the way back. And once he's back here, we're going to check the Romberg sign. He's going to close his eyes, and this is going to check for just the, balance. And he is able to maintain balance without a focal point, so that is positive. And now he's going to do a knee bend to touch his toes. And then reach down and touch your toes as well while I'm... Oh, yeah. Alright. We're good. All looks good. Now we're going to do range of motion of the spine. And while we're doing that, we're going to be checking his spinous process. You're going to move side to side, twist side to side, back and forth. All right. Now we're going to do a neurological assessment. All right. And you're just going to tell me if when I touch you, if the feeling is the same. All right, now if you can tell me positions that I'm touching as well, close your eyes.
Arms, upper arms, lower arms, fingers, thumbs, feet, calves.
All right, that's good. You can open your eyes. Now we're going to check cerebellar function. All right, you're going to do finger to nose, my finger while I'm moving it to your nose. And now if you'll do your, with the other hand. There we go. All right, now if you'll do from your heel to your shin, both ways. All right. Now we're going to check deep tendon reflexes. We're going to do the biceps and the triceps. Okay. Now we're going to do the patellar and, oops, if you'll just lean your, there you go. And now we're going to do the Achilles. And now we are going to check the Babinski reflex if you lift your foot. Okay? No flaring, so that's good. And with throughout, we could do patient teaching. Also, this is a good time as well to ask if they have any questions and give any further teaching. Do you have any questions?
Man, I'd like to know where I could pick up a nice set of scrubs like those. But other than that, everything looks good. I think you did great.
All right. Thank you very much. I appreciate it.
All right.